When you think of Canada, what do you think of? Equal rights, fair treatment, equal access to goods and services, unprecedented support, and open mindedness? While this rings true in a number of ways, research has shown that Canada's child welfare system in particular has not treated marginalized populations like immigrants, refugees, LGBTQ, and rural communities with many of the above mentioned values and qualities that Canadians are proud of. Unfortunately, the experience of these populations when it comes to their involvement with children's aid societies has not been positive. According to our research, both LGBTQ individuals wanting to adopt and LGBTQ youth in care have faced many barriers within the system. As recent as the year 2000, the Ontario Child and Family Services Act was amended to permit same-sex adoption. However, many LGBTQ applicants still feel discriminated against throughout the process, as Canadian social thinking has not actively progressed, leading many to judge or criticize non-heterosexual people and couples who want to adopt. Research shows that the LGBTQ teens are at a higher risk than their heterosexual peers for violence at home, in school, and in the community. When in foster care, LGBTQ youth do not often receive adequate support, and the violence continues. In addition to absent best practices and policies in working with certain populations, inequities such as poverty increases the probability of a family having child welfare involvement. With the experience of many people living rurally, a special report put out by the Child and Youth Advocates states that poverty continues to be seen as an underlying factor diminishing the realization of child's rights and increasing vulnerability in their everyday worlds. Service delivery model design has to consider how it can meet the needs of the local community more effective, such as lowering the risks of factor of abuse for children living rurally. These methods can include making it easier for rural families to access early years and early intervention programs and services to help them better meet the complex needs of their children, thereby creating alternatives to child welfare involvement as the primary answer to families at risk. Now, you may be thinking to yourself, how can child welfare workers become change agents, advocates for families? The reality is that many social workers working under the child welfare system do work under an anti-oppressive lens and attempt to do what is best for individuals and their families. When we did interviews with child welfare workers, they addressed the authority they had and their dedication to balancing out the power and oppression dynamic when working with marginalized families. A child welfare worker that we interviewed indicated that refugee parents want a better understanding as well as more collaboration from child welfare workers and policymakers. Our interviews also shed light on the many programs and policies in place to help marginalized families and communities such as immigrant refugees, LGBTQ, and rural communities. Being aware of some of these service gaps, Calgary Child Welfare Services and several agencies serving immigrants merged together to develop guidelines and procedures to direct staff working with diverse cultures. This one-stop shop service provided the staff with telephone contacts to gather information on how to better serve immigrant and refugee families, their culture, and culturally appropriate services in the community. To conclude, despite efforts made by the child welfare system, our research has determined that it has a long way to go for statistics to show positive outcomes to families and individuals who are involved. Workers with caseloads involving marginalized families, including immigrants, refugees, LGBTQ, and rural families, agree that more guidance is needed to be able to provide best practices in these instances.